Order. End of question time. The clerk will now proceed to read the notice of motion.
Item 1. Motion standing in the name of Minister for Health, building a healthier SG.
Minister for Health.
Mr. Speaker, sir, I beg to move that this House endorses Paper Command 19 of 2002 on White Paper on Healthier SG as the basis to transform our healthcare system by A. Focusing strongly on preventive care, B. Fostering lasting relationships between residents and family doctors, and C. Building strong partnerships within the community so as to support individuals taking care of their own health and wellness and strive towards our vision of long and healthy lives for Singaporeans. Sir, COVID-19 has put all healthcare systems in the world under stress. It exposed the shortcomings and weaknesses of the systems. On the other hand, it made practices that used to be impossible possible now. It was a jolt to the core of all our systems. As the pandemic dust settles, many health authorities are now in a soul-searching mode, rethinking how to improve their healthcare systems. For example, Indonesia, I'm constantly in touch with the health minister, and they are making a big effort to strengthen the accessibility to healthcare services throughout the archipelago. New Zealand is strengthening central national healthcare planning to reduce the pressure on specialists and hospital care on the ground. The UK is making a renewed push in integrating care, in integrated care between social and healthcare organizations. And just yesterday, we heard Hong Kong is also doing a deep healthcare reform effort. As for Singapore, we are embarking on a long-term and profound reform effort. And there are two important considerations in driving this reform. First, our society is aging rapidly. To reduce the disease burden and preserve the quality of life of our people in the coming years, we have to become healthier. Second, our COVID response showed that as a people, each of us are prepared to do our part, have each other's back, and work together to fend off the pandemic. The things we do during the pandemic, vaccinations, tests, self-isolation, and these are all preventive care in action. We found ways to integrate preventive care with acute care in hospitals, in our treatment facilities, and with home recovery. And if we can replicate that whole effort in our fight against debilitating chronic illnesses, especially those that come with aging, then we would have made a big difference in the coming 10 years. And that is why we developed the Healthier SG strategy, which I announced in the Committee of Supply early this year. It is a fundamental reorientation and reform of our healthcare system. Focus on preventive care instead of curative care, emphasize on health instead of sickness, shift the center of gravity of care away from hospital into the community, rely less on doctors for health, but depend on communities, our families, and ourselves. Live up to the name of Ministry of Health, not Ministry of Sickness. During COS, I said that we would seek the inputs of stakeholders as we flesh out our proposals, and then we'll come back to Parliament again. So here we are. And since then, MOH engaged more than 6,000 members of the public, including 1,000 healthcare professionals. We did surveys, focus group discussions, in-depth one-to-one interviews as well. In this engagement, we did not present our stakeholders with a blank canvas and ask them, what do we do to improve health? Instead, we presented a broad plan, a concept of what we plan to do. And then we asked them, looking at this, what's missing? What's your concerns? what are the details that matter, how to make it work, what are the potential pitfalls. It is an important process to make sure that we design the system right. And we got many useful inputs, which we have tried our best to incorporate in this white paper. So I want to say a few thank you. First, thanks to all our stakeholders for your contribution. They took the engagement very seriously. And I think they realized that this is a very important exercise, very important reform, possibly the most significant in decades. And I want to especially mention about 50 family doctors. They are from the College of Family Physicians Singapore, Singapore Medical Association, our primary care networks, polyclinics, National GP Advisory Panel. They devoted a lot of time and energy in working with us in designing Healthier SG. They meet almost every week, over weekends, on top of running their clinics. I would also like to extend my appreciation to the many healthcare practitioners and partners. They range from nurses, allied health professionals, pharmacists, people who work for community organizations, unions, grassroots leaders, employers. They shared their views and contributed their ideas. Last but not least, I also want to thank the officers of MOH, who did a lot of the coordination, the staffing, the drafting, and the preparatory work. I know they are very proud of being part of this co-creation effort with all our partners. Today, I will do three things. One, I'll go through very briefly salient features of Healthier SG as a recap. Two, explain what this means to the two most important sets of stakeholders, residents and GPs. Three, I'll speak more about its budget and financial implications, as this is only briefly covered in the white paper. So one, to recap, there are 5 key components to Healthier SG. First, family doctors. They are the linchpin of Healthier SG. We want to mobilize them to build strong relationships with our patients and play a bigger role in preventive care. 2, health plans. These will be developed between doctors and patients. Health plan comprises an overview of the health status of the resident, the health goals to achieve, an action plan, which can include going for essential health screenings and vaccinations, and changes to your lifestyles. This whole area is what we call social prescriptions. And doctors are saying social prescriptions are often more important than drug prescriptions. This brings us to the third component, which is community partners. It may not be easy to follow diet or exercise advice and improve lifestyles by ourselves. Many of us tried, to no avail. So we will draw on the effort of agencies such as Health Promotion Board, People's Association, Sports SG. They are organizing many health-related activities on the ground to create that supportive environment to help us change. And once the first 3 components are ready, we embark on the fourth, which is the national enrollment exercise. And this will commence in the second half of 2023 next year, starting with residents 60 and above. Then each resident chooses the family doctor or clinic you wish to build a long-term preventive care relationship with. And from there, we begin our journey towards better health. Finally, fifth, enablers. We need the right IT system, manpower, financial structure to make Healthier SG work. These are invisible, they are in the background, but a lot of work has gone into it, and they are extremely important. What will all this mean to people? Let me start with the most important stakeholder group, residents, whom we represent here. The greatest impact is that residents will receive much stronger support to stay healthy and prevent existing illnesses from worsening further. And we are making a big effort to support you because it is almost human instinct to not do the right thing because of instant gratification. Have a path to distress now, worry about health later. Eat the cheesecake now, worry about sugar later. Eat the fried chicken now, it's very nice. Laze around instead of exercising. binge watch Korean drama instead of having a good night's sleep. Now, all this instant gratification. Everyone's smiling, we're all guilty. Nothing bad will happen immediately or next day, but they accumulate to cause serious diseases or can aggravate existing illnesses later. Every grain of sand you keep dropping will become a bucket. And by then, it will be a big burden. It can cost us our organs, our limbs, our minds, our lives. I visited NKF recently. They told me every day, 6 more patients in Singapore requires dialysis. Every day, 6 more. To be on dialysis means you visit NKF Center 3 times a week. Each time, 5 to 6 hours. Your life totally changed. And the staff told me that most patients there at NKF, they regretted not correcting their diet and lifestyle while they could. But now it's too late to reverse. They have to live with dialysis the rest of their lives. So let's try to live without regrets. We can still enjoy many things in life, especially the good food, the char kway teow, the prata, the mee rebus, the occasional bubble tea with less sugar. Just everything in moderation and without overindulging. And we will find joy in exercising, especially with friends. We will be able to snub out smoking or juuling and not miss them. The support to residents. We must support residents to do all this. And it comes in several ways. Let me just describe how we are supporting residents. The first and most significant form of support is your long-term relationship with a family doctor. And research has shown people with a dedicated family doctor are much less likely to develop serious illnesses. Your enrollment with a dedicated family doctor is therefore a critical first step. However, since the release of the white paper, there have been a few concerns on enrollment, and I might as well clarify in this opening speech. Some residents are worried once you choose a doctor, it's a final decision, cannot reverse. Not to worry, we recognize that there are times when a resident needs to change their doctor, either because they move house or they change or found a more suitable doctor. And so we have provided the flexibility for residents to change your enrolled doctor. Nevertheless, please make your choice when the time comes, carefully, consciously. Other residents are worried once they enroll with a doctor, they cannot see other doctors, banned, including specialists that they are now seeing because of their chronic illnesses. So please be assured this will not happen. You are free to continue to visit all other doctors, including your specialists. But please choose one to be your dedicated family doctor whom you trust, who knows your conditions well, and can work with you to practice preventive care. In the same vein, some residents are worried that their regular GP may become so popular, they get squeezed out by the demand. We will try our best to manage this. In the enrollment process, there will be a drop-down list. The doctor you regularly visit will be at the top for you. Yeah? So that will give you an edge over your competitors. And we are working with GP networks and polyclinics to let us know who their regular patients are in order to facilitate this. And we are also doing enrollment in stages so that enrollment demand will not be overnight so overwhelming. You may also want to enroll early when the time comes to choke your regular GP. Yeah. Second area of support is that once you are enrolled with a family doctor, government will fully fund the most important aspects of preventive care. Hence, annual preventive care check-ins with your family doctor, nationally recommended vaccinations such as influenza and pneumococcal vaccinations, and health screening will be free. Health screening, they will include 3 common chronic conditions: type 2 diabetes, hypertension, and hyperlipidemia, and 3 cancers: breast, cervical, colorectal. And these are recommended for the general population and will be free. Those with specific risk factors may be referred for further tests. And there are more complex screenings, like colonoscopy. It is an invasive procedure and not appropriate to make it become a standard screening for everyone. And although not free, it will continue to be heavily subsidized at our hospitals. Third way to support residents. If you are using MediSave to pay for the treatment of your chronic illness, you are no longer required to co-pay 15% of the bill using cash. You can just use your MediSave. And these changes are somewhat a departure from most government subsidy schemes where some co-payment from residents is often required. It is to reflect that sharing of responsibility and uphold the concept of individual effort. Here, we decided that since preventive care is very fundamental to healthcare, further subsidy is justified. It does not contradict the principle of personal responsibility, because in the context of preventive care, personal responsibility and action are needed to make changes and lead a healthier life. Fourth, we will enhance the subsidy for common chronic disease drugs at private GP clinics. Many residents gave feedback that there is a significant drug price differential between GP clinic and the polyclinic. So even if they stick to one family doctor at the GP clinic, when it comes to taking drugs, taking medication, they go back to the polyclinic where the medication is cheaper. So to help residents anchor with a family doctor of their choice, we intend to level this price difference by introducing an additional subsidy tier to CHARS for common chronic drugs and also set drug price limits. This benefit will be available to all enrolled Singaporean CHARS card holders, including Pioneer Generation and Merdeka Generation card holders. I should add a small caveat, which is the basis of calculating subsidies at polyclinic and for CHARS are different. So there's a technical reason, but we will not be able to equalize the price down to the last cent. But we will substantially or substantively remove the current difference in drug prices between the two for individuals enrolled in Healthier SG. Fifth, we have roped in important community partners, PA, Sports SG, HPB, and others, to organize more health-related activities for residents, from ball games, and brisk walking, Zumba, community gardening, so on and so forth. So while you may see your enrolled doctor only once or twice a year, outside of the clinic, you will not be alone. We are enhancing public infrastructure like sports facilities, parks, and park connectors, and community partners will support your active lifestyle. 6, we will award health points to help encourage residents to adopt and sustain a healthy lifestyle. Many residents who already participate in the National Steps Challenge and the Eat, Drink, Shop Healthy Challenge are familiar with the Healthy 365 app. It is your virtual companion to nudge you to be healthy. This app awards health points for living an active lifestyle and make healthier food purchases. It does not just clock steps, but also track physical activities through your heart rate. So you may be dancing, lifting weights, doing community gardening, doing Zumba. Healthy 365 don't exactly know what you're doing, but it knows that your heartbeat is higher, your heart rate is higher. And from there, it derives that you are physically active and will award points accordingly. Health points can be exchanged for a range of rewards, such as public transport and at participating merchants. The reward is not large, but it has a way to give us psychological satisfaction that I accomplished this exercise. And it's very effective nudge, especially when it's gamified. We will be enhancing Healthy 365. For example, it will be able to track your calorie intake. So you take a picture of your char kway teow, and then you will match against our database of different food and their calorie intake, and it will monitor your calorie intake. But you have to take honest pictures. Don't just keep taking vegetables. Yeah. We have also made Healthy 365 compatible with popular digital health apps like Apple Health Kit, Fitbit, Samsung Health, all these are already compatible. And we will try to link it up with other commercial digital health apps. That way, your lifestyle data captured by these commercial apps can be ingested into Healthy 365, and you can claim health points. So what do we have? I should mention, in this house, I do notice some of our members have really become a lot fitter visibly. I noticed Mr. Desmond Chu over the months, big change. Mr. Wan Rizal, amazing change. And my second Minister of Health, Masagos, I think they should be Healthier SG ambassadors. So what do we have? To summarize, a dedicated doctor, a health plan with social prescriptions, full subsidy for nationally recommended vaccinations and health screening, full use of MediSave for chronic disease management, enhanced subsidy for common chronic drugs at GP clinics, more community lifestyle activities, more health points for leading a healthy lifestyle. They all come together, complement each other to support residents to take personal responsibility and action to embark on their healthy life journeys. Now, the second important group of stakeholders, family doctors from both polyclinics as well as GP clinics. They will find themselves at the center of this strategic long-term healthcare transformation plan. GPs need to earn a living by running their clinics. So we must make sure that Healthier SG works for them. Hence, from the time we conceived Healthier SG, we were very mindful that it should not take away business from GPs. So GPs will continue to attend to their existing patients and prescribe medication to them. What Healthier SG does is to enlarge their client pool through enrollment for preventive and chronic care consultations. In line with this, GPs should be fairly compensated by MOH for their effort and advice in delivering preventive care. MOH, therefore, will extend an annual service fee payment for each resident who enroll with them. This service fee is what we will describe loosely as a capitated payment. This means we do not pay the GP for every consultation, every test, every prescription, and every service they provide. Instead, we pay them this standard fee, which is a base per enrolled patient, and this is for maintaining a long-term relationship with the patient. It will cover regular check-ins, ensuring the resident adhere with his health plans, the associated administrative work, and also reviewing the health plan annually. This is over and above subsidies for health screening and medication, which are separately funded. For government, this method of payment and subsidy is not new. This is largely how we fund education, where, say, polyclinics, universities, they receive a standard dollar amount of budget per student, even though some students take more modules than others. Some students participate in more subsidized activities than others, but we pay an average standard budget. For GPs, it's also not a new concept. GPs who assist our healthcare clusters to manage complex chronic patients, today they get a Care Plus service fee payment of $100 per patient. Healthier SG will broaden such schemes to cover preventive care for the large segments of population. And the fee will be similar or higher than the current Care Plus fee, depending on the health conditions of the enrolled residents. So we estimate in the coming few years, Healthier SG service fees revenue from subsidized services can grow as more residents enroll and become a significant component of the GP's annual revenue, maybe a quarter, maybe a third. So hand on heart, MOH, I think, has always been very fair and prompt as a service buyer. And I assure GPs that we will continue to be so. What MOH may not be very good at is to minimize your admin workload. It is unfortunately inevitable, as we need medical data of patients to be captured in our national healthcare record, and paperwork is needed for payment claims. But we will try our best to minimize and streamline this admin workload. Some GPs also do not have IT systems to support Healthier SG. Some are still using pen and paper. MOH will also provide a grant to each GP clinic to help them be IT ready for Healthier SG. Mr. Speaker, sir, let me now move on to elaborate more about the finance and budget implications of Healthier SG. Healthier SG requires a lot of effort and resources to set up. We need new IT systems, ground support capabilities, give GPs that one-time support for necessary IT enhancements, capability building to bring them on board. So we estimate a setup cost of over $1 billion over the next 3 to 4 years. Beyond that, there will be recurring costs, and this includes all the support measures for residents I talked about earlier, the annual service fee for GPs. This will come up to $400 million per year. We spend about 6% of our healthcare budget on preventive care annually, such as to fund the HPB. With Healthier SG, in the coming few years, we will and we want to grow this, perhaps to double its share of the total healthcare expenditure. In making these investments, our main and primary motivation is to reduce disease burden, reduce the suffering of people and their loved ones. Will there be a financial payback in terms of reducing healthcare spending in future? It will be good if this comes about, but it is too early to give a realistic estimate. Because any impact in the health of people wouldn't happen immediately. The impact will perhaps be discernible 8 or 10 years down the road. Even so, let's be clear. We cannot reverse the rise in healthcare spending. It is not possible with an aging population. But what we can hope for is to slow down the rate of increase of healthcare spending. Today, our national healthcare expenditure is expected is about $22 billion a year. And this is the annual medical bill for the whole nation, $22 billion. We are expecting it to almost multiply threefold in the coming 10 years to $60 billion in 2030. So if this national medical bill, instead of tripling, double in the next 10 years, we would have saved much more than what we are planning to spend on preventive care. At the heart of Healthier SG is a philosophy of how we choose to live our lives. If we put in a bit of effort every day, a bit of discipline every week, a bit of restraint every week, we can avoid big life-changing suffering later. We can illustrate this logic from a personal perspective. Earlier on, I talked about the kidney dialysis patients at the NKF and how they regretted not taking preventive action earlier. So if they had practiced preventive care, it would have cost them very little in effort and in money. They may have to see their GPs periodically to take some advice, moderate food intake and sugar intake, which actually save money, take some medication as needed. But when the disease is allowed to go out of control and dialysis is required, it costs about $25,000 a year. Taxpayers, donors will have to help foot the bill. But the bigger cost, and which is what we are most concerned about, is the personal suffering. Some residents say, I prefer not to do preventive care now. I prefer not to do health screening now. Better don't know. Because if I know, I need to do something about it, and the bill can be expensive. I really hope we don't have such a mentality, because even if you choose not to know now, the disease will make sure you know later. And when the disease makes sure you know later, it will be even more expensive. Not in monetary terms, not just in monetary terms, but in suffering for you and your loved ones. Mr. Speaker, sir, let me now say a few words in Mandarin. 议长先生，卫生部从今年3月起，通过各个管道，聆听了超过6000人对于健康 SG 的想法和建议，成就了这份白皮书。我们向公众征求意见的时候，不是从零开始， 而是呈现了卫生部在健康 SG 战略上的想法的执行概念，然后征求公众的意见，看大家有什么顾虑、疑问和建议。在这个过程中，我们也认识了自己的盲点，而通过公众的反馈，我们能够使这个计划变得更完美、更有效、更实际。我在这里要由衷感谢大家的意见和支持。白皮书叙述我们要如何通过各种方式帮人民过得更健康，重点如下：第一，也是最重要的，是确保每个国人专一的看一个家庭医生或到一家诊所。至于哪一个医生、哪一间诊所，人民是有选择的，也有换医生的伸缩性。我也要澄清，健康 SG 的家庭医生不仅限于私人诊所医生，也包括综合诊疗所的医生。所以一些年长者，如果现在固定去综合诊所呢看医生，可以继续做下去，不需要转换私人诊所。第二，政府将提高预防性医疗的津贴，这包括了卫生部推荐的身体检查、接种疫苗和定期预防性医疗的看诊费用。这些医疗服务，政府会提供全额津贴，就是你不用付钱，政府帮你付完。第三，许多国人已经有了慢性疾病，而动用保健储蓄来支付医疗的费用。以现在的条例，大家需要用现金来共付一部分的费用。在健康 SG 的制度下，我们将取消用现金共付慢性病医疗费用的这个条例。第四，我们将通过这个 Healthy 365的应用程序，扩大健康生活的奖励范围。许多国人已经积极地参加全国健步大挑战，就是 National Step Challenge 这个活动。但除了步行以外，其他活动，例如打球、跳舞、园艺、健身等等活动，都能够获到奖励。有了数码科技，吃的健康也有奖励。福建话说：“哎，有价够价。”有些人可能觉得做体验啊、做体检、打疫苗、固定看医生等等，都是没有必要的。很多人都觉得这么说。我们常常会听到这一类的故事，说我的朋友某某人啊，每天抽1包烟，每个礼拜吃肥肉，活到90岁嘛，所以不需要做这些健康的活动。我觉得这是一种中马票心态啦，中马票心态，因为不健康但没有病痛的就是赢家，而且赢家是绝对极少数的，就是那些中马票的。我们都知道，每星期买马票的人，没有中的人是大多数，中的人是少数。大致上，生活不健康，往往都是输家，病痛找上门的可能性很高。所以不要把健康和生命，自己的健康和生命拿来做赌注啊。之前在《联合早报》，我读到了唐代名医孙思邈的名句，我觉得非常有意义，值得在国会重复。名句说：“上医医国，中医医人，下医医病。”意思就是次一等的医生只会医一个人身上的疾病，中等的医生可以处理好一个人的整体健康，而高明的医生可以提高一个国家的人口健康。孙思邈还有下一句，他说：“上医医未病之病，中医医预病之病，下医医已病之病。”这很有意思，很有道理。健康 SG 所要做到的就是上医医国的宗旨，保健不单靠药物，也靠生活习惯；保健不单靠医院，也要靠社区；保健不依赖医生， 也接种个人和家庭。西方医学其实也有同样的概念，把保健体制也分化为不同的体制。西方医学呢有医疗体制，就是 healthcare system， 就是医病跟医人的体制；也有人口保健体制，就是 population health， 就是医国的体制。中西都有这样的概念。健康 SG 是一个横跨很多年的长期策略。这份白皮书是我们国家保健政策的重要转捩点，对卫生部来说是一件任重道远的工作。它的成功靠人民和国家的配合与努力。Sir, let me conclude. Healthier SG involves a mindset change in the way we look at healthcare. I would like to quote a passage in the white paper. Quote, "We need to do things differently. Clinicians will need to constantly think of ways to prevent residents from falling sick against instinct trained to treat as many suffering patients as possible. When conducting health screening, we will have to deploy less precise but more scalable solutions to identify residents who have higher risk of falling ill. Policy planners need to develop and evaluate programs and initiatives across a multi-year budget cycle, consciously investing in preventive care now to avoid years of pain and suffering later. Every player needs to work closely, increasing the extent and depth of integration of their services." Unquote. Only by doing things differently and collectively can we achieve results beyond what traditional healthcare can deliver. In Western medicine, there is a distinction between different levels of health system. The traditional understanding of healthcare system comprises primary and acute care, ICU, hospitals, clinics. But there is also the concept of population health, where healthcare, social support systems, societal habits come together, and plus personal responsibility. They all come together to make a population healthy. It is a higher level of health outcomes, going beyond what medical personnel alone can do, but what a whole society can achieve. And there is a similar concept in Chinese medicine. It is well summarized by Tang Dynasty Dr. Sun Shimiao, who said, 上医医国, 中医医人, 下医医病. And that saying, essentially, without translating it in detail, it differentiates between the outcomes of curative care, preventive care, and population health. If all of us come together to make Healthier SG work, we will progress towards the holy grail of healthcare, healthy longevity. And that is when the number of years we can live healthily approximates the number of years we can live biologically. Mr. Speaker, sir, I look forward to the views and suggestions of members of the House. Thank you.
Members will be glad to know that parliamentary sittings can be part of the Healthy SG range of activities as well. Our heart rate goes up considerably at times.